Hi everybody, it's Andrea Dowd from Precision Sports Therapy here, and today what we're going to talk about is ankle inversion sprains. With soccer and outdoor activities starting up again, we're probably going to be seeing some of these, and what exactly are they and how can you rehab them. So an inversion ankle sprain is when you go over onto the outside of your foot. So if we were to look at our foot, it would be like that. So this motion is called plantar flexion, and this is inversion. So it's a plantar flexion inversion ankle sprain. Now, if you're coming down from a height, potentially you could get what's called an avulsion fracture, and there's a bone on the outside of your foot called a fibula. It's the ankle bone, and the ligament may pull a piece of the bone off. So we have to kind of rule that out first. So the ligaments that are involved with the ankle sprain are, if we were to look at our foot, it's on the outside. And the nice thing about the actual names are they're based on where they're located on the foot. So the most common one that gets injured is the anterior talofibular ligament. So it goes from the talus to the fibula. So it's in this area right here, right in there. And then that's the most common. Then we have the calcaneofibular. So it comes around from the calcaneus up to the fibula. And then the last one, the least common one, is in the back of the foot, and it is the posterior talofibular ligament. So that's the least common. Now, if we were to think about how these ligaments tear, we have ligaments that are attached bone to bone. And what happens is once they're stretched, unfortunately, they don't go back. And we grade it on a system of grade 1 to grade 3, a complete tear versus just a little tear. So if we were to think about when we rip toilet paper, so what happens is when we have a small tear, it just kind of a little bit of tear like in the toilet paper. Then if we keep ripping, that's going to be more of a tear in the actual ligament. So it's going to decrease the integrity of the joint, and it's not going to allow stability of the joint. If we keep tearing it, eventually the ligament is no longer going to be intact, and unfortunately there is not going to be any stability or integrity into the joint. Now, in the joint itself, what happens is there's a lot of swelling. And so the first thing we need to do is get that swelling down so we can increase the range of motion. But the most important thing is when you tear ligaments, you kind of have people that live in your joint. They're called proprioceptors. And those people that live in the joint tell your joint is where it's space and time. So a lot of people, what happens is they forget to do balance and proprioceptive drill training for the foot. And so you're in a perpetual state of rolling your ankle all the time. So watch for the next couple videos on how to rehab the actual sprained ankle.